Within the last week, there have been three major conversations brewing about healthcare coverage. The folks that want to repeal and replace, the folks that want to stabilize and shore up the Affordable Care Act, and the folks that want to look at something like Medicare for all. I'm Brynne McBride of ABC for Health. We're talking about a single-payer proposal coming out of Senator Bernie Sanders within the last few days that say we can do healthcare coverage in a totally different way that's going to impact more people and save more money. Now, the idea of a single-payer healthcare system is not new. And even the proposal of Medicare for all is not new. But the way that this bill is written is a little bit different. So we thought we'd share a couple of the major bullet points coming out of this legislation and then tell its likelihood of success. First of all, it is a publicly funded healthcare program that Bernie Sanders has sketched out for us. He has the transition from Affordable Care Act to Medicare for all taking 4 years. The first year is to start bringing in the margins of age groups to add to the Medicare roster. Don't start looking at Medicare at age 65, start looking at it at age 55 and add the kids up to age 18 at the same time. Bring those two groups of people in from the edges and slowly work your way towards the center over the next 3 years until you've covered everybody. Right away out of the gates, there were 16 co-sponsors on this bill. It was a popular idea. Is it going anywhere? No. And Bernie Sanders says this himself, so do some of those very vocal co-sponsors. And here's why they're still pursuing it, because it's informational and educational. We're learning a lot about best practices and how to cover more people when we look at this type of legislation. And here's the rationale for the bill. You're growing risk pool, you're growing the size of the number of people insured, which then gives you, as the insurer, power. What kind of power? Well, you can start negotiating prices. When you've got that many people that are covered, you can build in a little bit more efficiency and you can start negotiating with drug companies, for example, for discounted prices for the folks that are in this Medicare group. Large risk pools allow government to negotiate drug prices, build efficiencies, and streamline processes. That's the rationale behind Medicare for all. You can read Bernie Sanders' bill in its entirety. He puts it right out there on his website. He also went ahead and wrote an op-ed for the New York Times, and he spells out his rationale for why he thinks Medicare for all is a good idea. We then share with you some articles of interest, and they talk with a couple senators that are pretty honest about, this isn't going to go anywhere. We have a contentious legislature right now, a Congress that does not want to move on Medicare for all. We have a lot of interested parties, but this is not going to pass this Congress, and it's certainly not being signed into law by this president. That's the admission. But it goes into a little bit more detail of why this still might be something for folks to learn a little bit more about now so they could plan for the future. It's an interesting read and see what you think. You can share your thoughts with us by clicking on that information button. Tell us what your thoughts on Medicare for all are. You can share your story, your healthcare story, send a question. If you're watching us on YouTube, you can like or share or subscribe to our channel. Thanks for watching.